member for Dartmouth North.
Mr. Speaker, we are hearing concern from parents and healthcare professionals alike about emergency department overcrowding at the IWK. This past weekend, numbers at the IWK Emergency Department reached a record high of 200 visits, nearly double the levels from this time last year. Parents have turned to social media to describe lengthy wait times, such as some as high as 15 hours. In the past week, both the Chief of Pediatrics at the IWK and the Chief of Emergency Department have raised concerns to local news outlets, warning that, quote, the healthcare system will become unsafe if it gets stretched too much more. And I'll table that. Mr. Speaker, why are our healthcare leaders having to work so hard to get this government's attention?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for the question. So we're certainly aware of the increased pressures in our healthcare system, especially with the IWK. It's certainly an issue with RSV and other sort of respiratory illnesses that have peaked a little bit early this year. Having experienced the system myself with a young child, I would say that the care is certainly tremendous at the IWK, and I certainly thank them for everything that they're doing, and we will continue to support them. Thank you, Mr. Speaker.
The Honourable Member for Dartmouth North.
Mr. Speaker, earlier this year, the Minister of Health suggested that the surging emergency numbers were due to, quote, a number of people who have never experienced a child being sick because they have toddlers who were born during COVID. And I'll table that. We know that parents aren't waiting for 10+ hours in a crowded ER without good cause. A third of all IWK emergency visits are triaged as having high risk for loss of limb or functions or signs of a serious problem. And many families don't have alternative means of accessing care. So, Mr. Speaker, when will families get the pediatric emergency care they need?
The Honourable Minister for Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for an important question. So I think it's always important to know that within our healthcare system and within the IWK, there is a triaging system in place. So anyone that needs urgent care will always receive it, especially a sick child. I certainly know the clinicians are definitely doing the best that they can, and we'll continue to monitor the situation very closely. Thank you, Mr. Speaker.